Hey everyone, it's me, Dr. Whimsy, and today I want to talk a little bit about how to improve oxygen to the brain. And I want to first start by talking about why improving oxygen flow to the brain is so important. And that is because our brains need oxygen in order to function properly. They need lots of oxygen. And so when we see a decline in oxygen to the brain, we also can have a decline in mental function. So that is why we're focusing on it. Now, is it a risk factor as we get older? Yes, it's a risk factor when we get older, and it's also a risk factor when we suffer from chronic diseases. So some of the signs and symptoms that you may have: poor oxygen to the brain, maybe difficulty concentrating, poor memory, frequent brain fog, depression and mood changes, fatigue, and poor concentration, or just trouble putting thoughts together. Those are all of the signs and symptoms, I might have left a couple out, of why we suspect a person may have poor oxygen flow to the brain. There are also risk factors. Reasons why a person might have impaired oxygen to the brain. For example, if they've had a prior history, for example, a traumatic brain injury, if they've had a stroke, if they've had a heart attack, if they have any kind of respiratory disorders like asthma, COPD, emphysema, another form of COPD, emphysema, bronchitis, if they have any kind of chronic lung disease, if they have any chronic circulatory disorders, then also theoretically there could be problems with getting oxygen flow to the brain. Some of the conditions we think about, I'll go ahead and list those now: asthma, emphysema, anemia, Alzheimer's disease, coronary artery disease, atherosclerosis, diabetes, autoimmune disorders that can cause chronic inflammation, prior stroke, head injury, recreational drug use, particularly recreational drugs that cause, for example, methamphetamines that would cause any kind of extreme vasoconstriction could theoretically inhibit blood flow and oxygen to the brain. Smoking cigarettes is also a big one. Cigarettes can cause narrowing. They can also lead to emphysema, COPD, and that in turn would inhibit oxygen flow to the brain. Poor posture is something we don't think about, but if you're in a constant constricted state, for example, if it's due to your job and you're sitting in front of a computer constricted, then theoretically you would be constricting blood flow and oxygen as well. And just a lack of physical exercise. If you're not breathing, if you're not moving, if you are sedentary, then again we're going to see lack of blood flow and lack of oxygen to the brain. So then, of course, the question is, can you improve oxygen to the brain? Well, we always start with sobriety, drugs and alcohol. If you're using drugs and alcohol and then you stop drugs and alcohol, then we can see repair to the brain. Clean, sober living is going to help with repairing any damage, and then a clean living, being physically active, eating a clean diet is definitely a good start. If you're smoking cigarettes, stop. That is the first thing. The second thing I want to talk to people about is simply the act of breathing. It doesn't have to be anything complicated. It doesn't have to be some advanced yogic technique, but simply sitting calmly and breathing deeply without holding your breath, but simply breathing deeply in, filling the lungs, and then slowly exhaling several times a day is in and of itself restorative and good for brain health. Another thing that we recommend, of course, is physical exercise, at least 20 to 30 minutes a day of cardio, getting up and hiking, moving, walking, anything that's going to get your heart up, and being in an environment that has clean oxygen. For example, hiking in the woods would fall into that category, or hiking in nature, so long as you don't have allergies. But anywhere that there's clean oxygen, The ocean often is rich in oxygen, so people who jog along the ocean sometimes get great oxygen. Cleaning up the diet is something we also talk to people about. Cleaning up the diet, and that's because poor quality food is associated with conditions like diabetes, which can have an impact on circulation, and it's also associated with coronary artery disease. So a clean diet that's mostly plant-based, if you can't do 100% plant-based, is associated with better heart health. And we always tell people that what's good for the heart is also good for the brain. So if you can't be 100% plant-based, that's fine. We encourage people to be 80 to 90% of caloric intake being whole foods, plants. You'll do very well for yourself on a diet like that. And you really want to reduce fat consumption, particularly the trans fats. If you are eating fats, we recommend the monosaturated fats, and we also recommend the omega-3s. So fish oil and cold-pressed virgin olive oil would fall into those examples of monosaturated and omega-3s. In addition to exercise and eating a clean diet, we also recommend some supplementation. Usually when people come into my office, we do prescribe some supplements. We don't want to overwhelm patients, but we do recommend some supplements. Studies have shown fish oil is a mild blood thinner, so you do want to talk to your doctor if you do decide to take fish oil. But in addition to being having a mild blood thinning effect, fish oil seems to also reduce inflammation, and inflammation is associated with increased risk for plaques, and plaques can narrow blood flow to the brain, and that is what we are trying to work against. So fish oil, a good quality fish oil. I go with fish oils that are molecularly distilled, so that we aren't worried about things like heavy metals. In addition to a fish oil, I also will recommend a CoQ10. CoQ10 helps keep the mitochondria healthy and functioning properly. Remember that aerobic respiration, the ability to make energy with oxygen, takes place in a part of our cells called the mitochondria, and it requires CoQ10. CoQ10 is a great antioxidant, but it also helps us create fuel from oxygen. So that is why we recommend CoQ10, particularly in patients who are on a statin medication. All right. I think that is pretty much all I had. Other supplements you might want to think about in terms of reducing inflammation, of course, turmeric. I like turmeric, particularly turmeric in a phytosomal form, because it tends to cross the blood-brain barrier, and it's one of those herbs that's also been researched for prevention of Alzheimer's disease. A B complex, particularly a B12, is associated with good cognition, and while it may not be directly associated with improved oxygen, we do see that B12 absorption, the ability to absorb B12, declines as we age. So those are just some of the supplements that I recommend here in my office, along with diet and exercise for improving oxygen flow to the brain. All right, I want to thank you for watching this video. My name is Dr. Whimsy Anderson. Be sure and share, like, subscribe, and I look forward to speaking to you again soon. Take care. Thank you. Bye-bye.